Hi, I'm Danielle Halpern. I'm a clinical psychologist at the Seaver Autism Center, as well as our director of graduate training. Today, I'm going to speak about autism spectrum disorders and their diagnosis. Autism spectrum disorder is a developmental disability that, according to recent estimates from the Centers of Disease Control and Prevention, affect between 1 in 50 and 1 in 88 children in America today. We do not know the exact cause of autism in many cases, but do know that genetics play a significant role. We know that males are affected at a significantly higher rate than females, estimates being about 4 to 1. We also see many associated symptoms when we look at individuals with autism spectrum disorder, including anxiety, behavioral issues, inattention, and cognitive deficits. When abnormal development is suspected, the first step is for a child to visit his or her pediatrician for developmental screening. If the pediatrician and parent feel that follow-up is warranted, there will be a referral to an expert clinician. The expert clinician will refer the individual for additional testing, including genetic follow-up. Individuals diagnosed with autism spectrum disorder present with deficits in social communicative functioning, as well as restricted and repetitive behaviors. These deficits have to impair an individual's day-to-day functioning and have to be present from early childhood. Regarding social communication deficits, individuals have to present with deficits in 3 out of 3 categories. The first category is deficits in social emotional reciprocity. In higher functioning individuals, this could be difficulties carrying on a reciprocal or back and forth conversation, and in lower functioning individuals, this could look like a lack of interest in social interactions with others. The second category is deficits in nonverbal communication. These include difficulties using nonverbal communication, such as modulated eye contact, directed facial expressions, or communicative gestures, to augment speech or compensate for speech delays. The third category is deficits in developing and maintaining social relationships. This can include difficulty maintaining and navigating existing friendships, as well as a lack of interest in peers. Regarding restricted and repetitive behaviors, individuals must meet criteria in 2 out of 4 categories. The first category is the presence of repetitive speech, motor mannerisms, or use of objects. This could be use of stereotyped or repetitive speech, speech that's borrowed from other sources, or motor mannerisms such as hand flapping. Second, we see adherence to routine and difficulties with change. This could be reactions to changes in schedule, or difficulty transitioning between activities. Third, we see the presence of restricted interests that can be unusual in their intensity or focus. And fourth, hyper or hyposensitivity to sensory input. This could be sensory seeking behaviors, such as seeking out certain textures, or sensory avoidance, such as avoiding loud noises or other sounds. The gold standard diagnostic assessments used to diagnose individuals with autism spectrum disorder are the ADOS and ADI. The ADOS, or Autism Diagnostic Observation Schedule, is a semi-structured direct assessment that a clinician does with an individual by creating a social world to pull for certain behaviors in communication, social skills, and look for the presence of repetitive behaviors. There are 5 modules depending on an individual's language level. The lower modules are more play-based, and the higher modules are more question and answer-based. Our next gold standard diagnostic assessment is the ADI, or Autism Diagnostic Interview. This is a 3+ hour interview with parents, also looking at a child's behaviors across domains, including communication, social skills, repetitive behaviors, as well as age of onset. This interview primarily focuses on the time between a child's 4th and 5th birthdays. What's notable about these instruments is that they do provide a classification rather than a diagnosis, and as with any instrument, we have to use our clinical judgment when providing a diagnosis. I hope I answered many of your questions about autism spectrum disorder and its diagnosis. Please tune into our other modules for additional information.